MACRA doesn't have to cost you and your enterprise in lost productivity and physician dissatisfaction. Many systems solve clinical quality measure requirements by adding quality reporting as just another task for clinicians. It slows them down and forces them down cumbersome pathways just to remain compliant. There's a better way. Quippe integrates MACRA and clinical quality measure requirements right into the clinical workflow without getting in a doctor's way. It adds on to any EHR so clinicians can address quality measures while they review the chart and start their plan, and works the way doctors think. Let's see how it works. We'll start with a patient who has been seen by a nurse that started documentation by entering vitals and history. You can take a look at the full Quippe documentation capabilities in some of our other videos. But today, we'll focus on how Quippe seamlessly incorporates MACRA clinical quality measures into the documentation workflow. The summary view of Quippe's clinical lens includes active problems, meds, lab orders, and review of systems, and looks like a patient summary in any EHR, with a couple of important differences. All of this data, which can come from anywhere, can be filtered and focused by problem to get context and follow clinical thought processes. Quippe can also tee up data into the note for documentation and order entry. And in the background, the system monitors what MACRA, MIPS, or meaningful use clinical quality measures for being met. We can see that this provider has opted in to several MACRA-related quality measures, including diabetes, tobacco use, and BMI. And as we enter data into the chart, this panel will be updated with the measures that become met, unmet, or pending. Some of these measures have already been met when the nurse started our note, and with the existing data in the patient's chart during the current reporting period. Our patient, MacEasy, has several problems, as shown in the active problem list. But today, we are going to focus on type 2 diabetes and hypertension. We're going to tap on diabetes type 2 to get a filtered relevant view of the patient's meds, labs, other orders, history, and vitals. We can also further focus on diabetes and filter out the rest of the clinical noise. Now that we are focused on diabetes, we can add these results into the note and add some orders. These orders will be teed up in the note for other order systems, so we can create the plan. We'll bring them into a new problem section of the note our nurse started. All of the data in the note and in Quippe Clinical Lens are mapped to the appropriate coding systems, such as SNOMED, RxNorm, LOINC, and ICD-10. We'll continue by documenting an eye exam for this patient. We'll indicate that the exam was normal, which will satisfy one of our opted-in measures for diabetes. Switching back to Quippe's clinical lens view, we can focus on the patient's hypertension, again filtering out the rest of the clinical noise. We'll pull in the relevant test results and medications, and automatically create a problem section for hypertension in the note. Let's continue documenting. Even though the nurse entered some tobacco history, we still haven't met the measure related to tobacco use. So we can open a tobacco use wizard and put MAC on Nicorette. And, in addition to meeting the measure, this will also include the order in our prescription writer. Similarly, even though the nurse entered vitals for this patient, we still haven't met the preventive care and screening measures for BMI. Using the vitals entered, the BMI wizard calculates the BMI, and we can see that this patient is overweight. Quippe serves up the remaining documentation requirements needed to meet the quality measure. We can see that as we documented, the Quippe Quality Measure Evaluation Service has updated the measures that are now met. From here, the clinician can continue their documentation. Quippe takes care of MACRA and meaningful use reporting requirements as a natural byproduct of documentation and saves doctors time. It provides the tools needed to be compliant while working the way doctors think, so providers can see up to 30% more patients. It adds on seamlessly to any existing EHR and can be up and running in a couple of weeks. Don't let MACRA cost you. Let us show you how Quippe can make MACRA work for you now. Visit Medicomp.com and schedule a demo today.